as you know, every second Monday of the month, LW Pharmacy School brings you a monthly free crash course, right? Every second Monday of the month at 7 p.m. Central Standard Time, we have a free crash course, okay? This video is going to shoot live. And so you will have the opportunity at the very end to ask some questions. If you do not know the information or the way to contact us, here is the information right here. LW Pharmacy School, 903-295-5933, extension 1. You can follow us on Facebook, Instagram, Twitter, LinkedIn, and we're also on YouTube at LW Pharmacy School. Just type LW Pharmacy School in and we pop up on every platform, okay? Tonight, you guys voted drug laws, and that's what I'm going to give you tonight. I have something really fun in store for us tonight. We're going to do something a little different that we've never done before. Typically, I kind of have a game for you, but tonight I want to open the floor up and allow you to ask some questions to me. I realize that some of you guys are not getting your questions answered when you're studying, and maybe you are going to study buddies or whatever, and you're not always getting your questions answered. So I want to make sure that I make myself available for you for that tonight, okay? If you have a friend who is studying for the PTCB or the EXCPT exam, tag them. Call them, text them, let them know, hop on. This is something that they do not want to miss, okay? We're going to get started. So when you are thinking about the drug laws and how like drug laws work and everything like that, let me turn my phone off before somebody calls. When you are working and learning your laws, you want to know the difference between laws and ethics, because it's very easy to run the two together, okay? So what is the difference between laws and ethics? Ethics is a standard or a study of standards and moral judgment, okay? It's typically influenced by a group, society, a philosophy, religion, or profession, okay? And so as technicians, we have a code of ethics that you should know as a technician. If that's something you would like for me to send you, I can also post it on our social media, the code of ethics for technicians, okay? Please remember that as a technician, your first consideration is to ensure the health and safety of the patient. In a pharmacy technician is supposed to support and promote honesty, integrity in the profession, okay? So you want to make sure that at all times that you are operating in honesty and that you are operating in a mode of integrity, which means that you can be trusted, right, at any given time, okay? We also know that our goal is to do no harm. As a technician, we don't want to do any harm to any patient at any time for any reason, right? So a pharmacy technician's first consideration is to ensure the health and safety of the patient, and a pharmacy technician must support and promote honesty and integrity in the profession, okay? If we had more time, I would tell you a story, but since we don't, I'm going to keep it strictly connected to what our PowerPoints are, because I want to make sure that at the end we can kind of open the floor up for to kind of talk and kind of share some things, okay? I'm gonna also make sure that I keep my chat open so I can see if you guys are typing or messaging me. Feel free to message each other while you're in the chat as well, and you can message me your questions and I'll answer them towards the end, okay? Pharmacy law and prescribing authorities. Okay, as a technician, you need to know the doctors who can actually prescribe prescriptions. Okay, so the doctors that can prescribe and write prescriptions are medical doctors, physician assistants, nurse practitioners, the dentist, okay, optometrist. Okay, you also have chiropractors. You don't see them on this list. Okay, if they're not on this list, they cannot prescribe medication for any reason. Okay. Chiropractors, is a separate type of practice. And unfortunately, they don't have the credentials or the education in pharmacy to be able to write prescriptions. Okay. Does everybody understand that? Okay. Another thing you want to know in pharmacy is that federal law takes precedence over state laws unless the state law is stricter than the federal law. Okay. In which cases the state law takes precedence. So that means that whatever law is stricter, okay? So let's say your state allows, this is just an example, your state allows individuals to purchase controlled substance without a prescription, but the federal law requires a prescription for controlled substance. Then we have to go with the federal law, okay? And let's say, you know, that the federal law doesn't require a prescription for OTCs, but the state law does. Then we go with the state law. Whatever law is the strictest law, that is the law that you must follow. And that's what you need to know. If you are in another state outside of Texas, or, you know, if you're not here, then you want to make sure that you learn your laws. I will be very honest and transparent with you and tell you that the information that I give you is on a national level. However, you still need to make sure that you do your research to learn your laws. Okay. I've only practiced in the state of Texas, so I'm very familiar with the laws here, and we're very strict in Texas, and everybody knows that. Don't mess with Texas. But you still want to learn your laws if you are, you know, in California or if you're in Florida, wherever you may be. You want to make sure that you know your laws and what the expectations of you as a pharmacy technician are. Okay. The next one is legislation that has affected pharmacy. What I've done for you all, because everybody's always like, Lindsay, can you just underline the information, or can you just give me the pointers that I need so I can be, you know, as productive and I can remember this stuff. I just want to remember what I need to know. So I've underlined keywords for you. Now I'm going to read everything, but I want you to pay attention to what I've underlined. Okay. You can write this down and try to memorize it as much as you possibly can. Pure Food and Drug Act of 1906. It is the law that prohibits the interstate transportation of sale of adulterated or misbranded food or drugs. Okay, so the FDA don't just watch over the drugs; they also govern the food, right? So you want to make sure that you remember that this law prohibits the interstate transportation or sale of adulterated or misbranded food or drugs. What does adulterated and misbranded mean? Okay, so adulterated, and I'm going to read this to you right from my book, so that way we can make sure. Oh, and again, my yellow book is the book that I use. Okay, and I knew someone would ask. Okay, adulteration just basically means that it is something that is unsafe. Okay, so if it's adulterated, that means that it's not safe for you to use. Okay, and then misbranding could possibly mean that they have not, the medication may have not been labeled correctly, or that it does not give the warning, you know, like if they're taking a controlled substance, and the controlled substance prescription has to say warning, maybe habit forming. Okay, so if the manufacturer does not give the customer or the patient enough information about the drug and be transparent, that's misbranding. It's like misleading. It's like you know something could go wrong and you're not sharing that information. That would be misbranding, right? The next one is Food, Drug, and Cosmetic Act of 1938. Okay, you need to know that this drug or this law was created by the FDA. Okay, it requires all new drug applications to be filed with the FDA. Okay, all new drug applications must be filed with the FDA. Okay, and it also clearly defines adulteration and misbranding. So that means that it makes it very clear that you have to come correct if you are trying to get a new drug on the market here, right? Okay. The next one is manufacturer drug labeling. Manufacturer drug labeling. The following information is required on all manufacturers' drug labels. Okay. The name and the place of the manufacturer, the packer or the distributor, the national drug code number. Does everybody know what the NDC number is? Does everybody know what that NDC number is? Hopefully you guys understand the NDC number, okay? The NDC number is an 11-digit number, okay? And you need to identify what the NDC number is and how it is used in pharmacy. Please know that every drug has an NDC number. Every drug. There's not one drug that does not have an NDC number, okay? And so you want to make sure that you know what the NDC number is and that you can actually identify it on the bottle when you see it. Last but not least is the expiration date. Every manufacturer drug label must have an expiration date, okay? No matter what, we need an expiration date on that drug. The next law is going to be the Durham Humphrey Act of 1951. This is an amendment to the original Food, Drug, Cosmetic Act of 1938. Okay, so an amendment is when they go back, and typically what an amendment is like they made this law. There were some gaps and holes in the law that didn't actually cover everything, and so they had to go back and amend. Right. So when you amend something, you're fixing something that is broken. Okay. So what they did was they went back to the 1938 law and they said we need to add this to that law or we need to amend it. Okay. And so an amendment to the FDCA in 1938 requires all products to have adequate direction for use unless they contain the federal legend caution. Federal law prohibits dispensing without a prescription. So what you want to remember about the Durham Humphrey Act of 1951 is that this is the law that requires a prescription. Okay, it requires all products to have adequate direction for use unless they contain federal law prohibit dispensing without a prescription. And the reason why they can do this is because basically what they're saying is without being under the care of the doctor, you cannot take this medicine. Why is that, Lindsay? I'm glad that you asked me. Okay. Federal, basically, this federal law says that this drug needs to be watched. Okay. So it means that when the person is taking this particular medication, they need to make sure that they are under the supervision of a doctor in case something goes wrong. Right. And so, with that being said, that's why a lot of these drugs now require, a doctor's order or a doctor's prescription in order for you to take it. Okay. So let's think about, if you've ever had to you called in for a refill and your doctor said, well, no, I want you to come in, and typically they'll give the patient a refill, but, in some instances they say, well, we've already given you one refill. So after this refill runs out, you need to come in and see the doctor. And they have to see you because they need to make documentation on your progress, and they also need to see if they need to increase the dose or decrease the dose. So in the pharmacy, you'll have patients who will call in and say, well, I ran out of my blood pressure medicine. Can you call the doctor and get a refill? The nurse may approve the refill and say, we're going to give them one more month supply, but please let them know that they need to come in and make an appointment to see the doctor. And that's basically because the doctor needs to see them and make sure that the doctor is constantly in communication with them while they are taking this medication because they need the supervision from that doctor. Hopefully that makes sense to you guys. And also, Durham Humphrey was the one who separated the drugs into two categories. He was the one that created legend and non-legend. So legend is prescription drugs, non-legend is OTC. Okay. Kefauver-Harris Amendment of 1962. This one requires that all medication in the United States be pure, safe, and effective. Okay. Pure, safe, and effective. Okay. It establishes the procedures for drug application and investigational drugs. And it requires that drug manufacturers operate under the Good Manufacturing Process, GMP, Good Manufacturing Process, okay? There was this drug called thalidomide, right? And I don't know if you guys have, and I got my book out tonight because I have so many of my people who are studying from the Yellow Mosby's book, and I just said, okay, I'm gonna make sure that I have my book out tonight when I do my class, so I can kind of refer back to it and things like that. But anywho, thalidomide was a drug that was used in other countries, and babies were coming out disformed. They might have had an arm growing onto their forehead, or they might have been missing limbs. And so, for that reason alone, they did this amendment to the original drug or to the original law because they wanted to make sure that they put in there it has to be pure, safe, and effective in order for it to be sold in the United States. Okay. Because again, in pharmacy, our main goal is to do no harm. We don't want to do any harm to our patient. Remember that. Okay. And so, with that being said, thalidomide is not even used in the United States at all. Okay. And so, any drug that comes in that wants to be used in the United States have to make sure that it can prove to be pure, safe, and effective. Comprehensive Drug Abuse Prevention and Control Act of 1970. This is a very serious slide. All of the slides are really serious, but this one is a really good one. Comprehensive Drug Abuse Prevention and Control Act of 1970. The DEA created and placed under the supervision of the Department of Justice. So this law was created and placed. It was created by the DEA and it was placed under the supervision of the Department of Justice. It's serious. Controlled substance placed in one of 5 schedules. Okay, so the first schedule we have is no acceptable use in the United States and extremely high potential for abuse. That is Schedule 1. So we're talking cocaine, ecstasy, okay? We are talking crack, okay? We're talking LSD. Those type of drugs that are mainly street drugs are not allowed. Well, I'm not gonna say they're not allowed because they're here in the U.S., but they have no acceptable medical use in the United States. So that means that a doctor would never prescribe crack to a patient, right? Because there is no acceptable medical use here in the United States for that particular drug, and it has extremely high potential for abuse. So please remember that Schedule 1 drugs are never used. Schedule 2, okay, have medical use but have high abuse potential. Remember that drugs are categorized by schedules in the schedule by their potential for abuse. So if the drug has a high potential for abuse, it's going to be at the very high, right? It's going to be really, really at the very top of it. It's like a stair step. So 1 being the greatest, 5 being the least, okay? And in Schedule 2, you're talking about like the medications that are used to treat ADHD, Ritalin, Adderall, Vyvanse, those type of drugs, they're all Schedule 2. Remember, your Schedule 2 drugs do not allow refills at all. No refills on Schedule 2 drugs at all whatsoever. No refills, okay? Also, with Schedule 2 drugs, they have 21 days to bring the original script into the pharmacy to get it filled. After the 21 days, that script is no longer good and they have to go back to the doctor to get another script. Okay. Please also know that a doctor could write for 90 pills of the quantity, 90 pills for Adderall. And you would say, well, how can you do that if you can only get 1 month at a time? If the medication or the directions require that the patient takes 3 a day, then they can do 90 pills for the quantity, but it will not be 90 pills for like a 3-month supply. Okay, it's only a month supply at a time. They have to go back and get it, a new script every time. They do not give refills for that drug, and that particular drug, unless there's a special case, somebody may be going out of town, and it's really special cases where doctors may do that for a patient, and that's if they're going abroad. But Schedule 2 drugs do not have any refills. Schedule 3 drugs have medical use, but their potential is less than Schedule 1 and 2 to be abused, and so they're Schedule 3. Remember, Tylenol 3 with codeine is a Schedule 3 drug. That is very easy to remember because it ends in 3. Okay, and then you have Schedule 4, less abuse potential than Schedule 3. And this one here can become a physical dependency, which means that it can be very addicting and the person can really become very addicted to this particular drug. Xanax is a Schedule 4. Xanax is a Schedule 4, and it can be very habit forming. And that's why they say here that, there can be some physical or psychological dependency here, okay? And then you have Schedule 5, which is at the bottom of the totem pole, and it has less abuse, or less abuse potential than Schedule 1, 2, 3, and 4, and that's why it's at the very bottom. The type of medications that may be here is like sleep meds, like Ambien is also there, Tramadol, those type of medications are Schedule 5s. And Schedule 3 through 5 do have refills. You can get up to 5 refills within a 6-month period, or you can get refills 5 refills within a 6-month period. So let me explain it a little bit, and I don't want you guys to, hopefully you guys can take this in and really absorb it, okay? So with Schedule 3 through 5 drugs, you can get 5 refills within a 6-month period, okay? So, or within a 6-month period. It depends on which one comes first. If the patient used their 5 refills up before the 6 months, then that's fine. They don't get any more refills. But let's say a patient gets the prescription filled in January, and when they get their script filled in January, the doctor wrote with 4 other refills, right? So the doctor may write Xanax, 30 pills with 4 refills, and the person gets this medication in January, and they don't really take their meds a lot, and so this medication may have last them from January until June, because June is the 6th month of the year, right? And they call the pharmacy and they say, "Hey, I'm ready to get a refill on my Xanax." And you pull up the script and you look and you say, "Oh, the prescription expired June 17th," which was the same day that you got the prescription written. And they say, "Well, yeah, but Lindsay, I still have refills on it." And you say, "Well, no, you may have the refills, but unfortunately, the time has maxed out. The script is only good for 6 months. So because of that, you're going to have to go see your doctor. We cannot give you the refill." Okay. And they say, "Well, I still have refills." And you have to explain to them the prescription, it has expired. And so for that reason, you're going to have to call Dr. Walker and, go and meet with him and try to get a new script. Okay. So remember that Schedule 3 through 5 drugs, their scripts expire in 6 months. They only have a 6-month expiration date. So that means whatever refills that the doctor may have prescribed to that patient, they have to get them within that 6-month time period. Okay. Drug Enforcement Agency, DEA. Okay. Registration. Remember this, there's a registration form called 224 in every pharmacy that wants to dispense controlled substance have to register with the DEA, and they must submit form 224. This form needs to be renewed in the pharmacy every 3 years. Every 3 years, they must renew this form. Please remember this form. This is a very serious form that, especially if you're working at Walgreens or CVS or any type of pharmacy that dispenses controlled substance, this form is used. When I first started working at pharmacy, I worked at a pediatric pharmacy inside of a doctor's office, right? It was the cutest little thing I had ever seen. And it was a doctor's office, and inside of the doctor's office, they had a pharmacy. And the coolest thing was that our pharmacy was connected to a convenience store. So y'all know, like, I was eating chips and drinking soda. Okay, whatever. But this was a pharmacy that only served children. So they didn't have a DEA form 2224. They didn't even have to fill one out because you don't give controlled substance to children, or you're not really, they weren't giving it to them. They were like really prescribing like amoxicillin and things like that. Now, you do have some kids who are on Ritalin and stuff like that, but this particular pharmacy was more so geared towards children who were coming in for colds and stomach viruses and things like that, the flu, just different little infections and stuff, wingworms, that kind of thing. Okay. And so they didn't have that. So I say all of that to say not every pharmacy has to fill out a form 2224 because they may not be dispensing controlled substance. Form 222 is used to order Schedule 2 medications, and it must be completely and properly filled out by the DEA. Okay. It must be properly and completely filled out by the pharmacy. Okay. And this form is actually sent to the manufacturer when you are ordering Schedule 2 meds. So just remember that Schedule 2 medications must use Form 222 in order to order the medication from the manufacturer. This should be really easy, just a bunch of twos. Just remember the two. You see 222, think Schedule 2, right? Schedule 2 order, just like that. The form is only good for 60 days. Any unused form must be kept in a secure location in the pharmacy under a lock and key. Okay, and you know why? Because we don't want any type of theft or anything like that happening to these forms where people are now able to go and write their own scripts, right? Drug Enforcement Agency, we're still talking about them. When we are keeping records in the pharmacy, we must keep these records on file for a minimum of 2 years, okay? Especially when you are doing a record keeping for Schedule 2 drugs. This one here talks about Schedule 2 drugs. It must be maintained for a minimum of 2 years and kept separately from other invoices. And we're still talking about when we're ordering the drug using the Form 222. When we're using that Form 222 and whatever invoice that we have for the Schedule 2 drugs, we must keep them separately from the other drugs, Schedules 3 through 5, as well as the non-controlled substance drugs, okay? So Schedule 2 drugs, invoices are kept in a separate area away from all of the other drugs. Please know that Schedule 2 drugs are really, really serious, and so is the DEA. They're not, playing around and kidding about this. So please remember, that form can be really, really serious, and it also needs to be readily retrievable. What does retrievable mean? That means that you can produce it right away, okay? It needs to be produced right away if the DEA comes in for an audit, okay? Defective DEA Form 222 must be kept for a minimum of 2 years as well and be readily retrievable. That means that, the DEA comes in, we can't be saying, well, you had the form. Oh, no, but then you gave it. They're not trying to hear that. You need to be able to produce that form right away so that way they can do their audits and move on. And, because the moment we can't produce the form, then it looks like something else was taking place and it's almost a little shady. And we don't want that to happen, okay? And so Form 222 is very important. So please remember Form 222 is used to order Scheduled Drugs 2. Scheduled Drugs 2 have no refills at all. Scheduled Drugs 3 through 5 have 5 refills within a 6-month period, okay? That prescription expires in 6 months. Regular prescriptions that are not C2 drugs or controlled substance drugs at all are good for 1 year. So, okay, so it's like if you get a prescription from the pharmacy today, right, then that drug or that prescription is good until October 14th of 2020, okay, as long as it's not a controlled substance drug, okay? So, sometimes when they write birth control scripts, they'll give, 10 or 11 refills on birth control because they're letting, the patient be on that birth control for the entire year. And that prescription is good from October 14th, 2019 to October 14th, 2020. And so that way they're not running back and forth to the doctor. But that, again, is only for non-controlled substances, okay? Now, if it's a controlled substance, it has an expiration date on it. Please remember that. Don't get caught up with that question on your board, okay? DEA agency, we're still talking about them. They are very important. I'm telling you, they are like the big people in the pharmacy, okay? This is a really serious topic here. Destruction of outdated or damaged controlled substance. DEA form must be submitted if for any reason there is a controlled substance that has been damaged or outdated. Outdated means that it's been expired, okay? You send those back to the manufacturer by using Form 41, okay? So a damaged drug would be a drug that broke in half. Maybe the drug, was chipped off a little bit. Maybe the drug dropped into something wet on the counter, which is why, again, we need to make sure that our pharmacy counters are dry at all times. You'll see your coworkers in there drinking juice. You'll see them drinking water. You may even see a coworker who sprays their counting tray down with alcohol before they get ready to count the next medication because they call themselves cleaning off their counting tray, right? But they didn't dry the alcohol up right, really good. And so then that pill got in there and now the pill started, it got wet and it kind of leaked a little bit. Well, that's a damaged drug and you can't really give that to the customer like that because they'll notice it and it's almost like, oh my God, something happened to my pill. And so with that being said, if that was to happen to you, you notify the pharmacist right away. I'll tell you a secret that I used to do. Whenever I got ready to count controlled substance drugs, I would stand right by the pharmacist and count it right there. Because I'm scary. I don't want to go to jail. Okay, I'm scary. They don't have flat irons in jail. And this is a whole nother topic. So anyway, but I would stand right by the pharmacist and count controlled substances because I wanted to make sure that they saw what I was doing. So that way no one could say something Lindsay did. No, I didn't do that. And so with that being said, anytime that there's an outdated or a damaged controlled substance, report it to your pharmacy your pharmacist right away, okay? They can submit Form 41 one time a year, okay? And most pharmacies do it at the end of the year when they're, doing their yearly inventory and they kind of send it out. You have some pharmacies that may do it semi-yearly. And you may have some who start their physical year in September, and that's when they send it out. However, whatever the culture or the protocol is of that pharmacy, you want to make sure that are aware of it. But at the same time, please make sure that you tell your boss that has happened, so that way they can report it and you can report it, and you guys can do whatever you need to do. When we use this form, we need to indicate the name, the strength, the quantity of the controlled substance, the date of the destruction, the method of the destruction, and the witness. Remember, I told you I go and stand next to the pharmacist. I can't play. I'm telling you, I just can't do it. Form 106 is used for theft. And so if for any reason a controlled substance comes up missing in the pharmacy, Form 106 is used. Hopefully you don't ever run into that problem. But if so, this form is used to report it. The pharmacy must notify the nearest DEA office as well as the local police. Okay. And this could get really ugly real quick. You can go to 0 to 100 real quick. Poison Prevention Act of 1970. Poison Prevention Act of 1970. This is the law that enacted the poisoning, that enacted to reduce the accidental poisoning in children. And so basically what all that is this is the law that put on there the child resistant caps, right? There used to be a time where people could just pop the tops off of the medication and children were getting a hold of it. And, we had some accidental overdoses. We were having some stomach pumping that we needed to do. And so now in 1970, what this law did, they said, hey, we are going to put something in place to make sure that this doesn't happen again, okay? And so this law requires that most OTC and legend drugs be packaged in a child-resistant container. There are 3 exceptions to this rule, okay? If the prescriber orders a non-resistant container, if the patient requests a non-resistant container, and if the manufacturer lists this package for a household without young children or packaged not child resistant, they can have it. Okay, so again, if the doctor requests it, if the patient requests it, or if the manufacturer lists on there that this is not a child resistant package, that can be there. Okay, I'll tell you a drug that is that does not have to have child resistant packaging: nitroglycerin. The abbreviation for that is NTG. NTG. Nitroglycerin is used for chest pain, right? So with that being said, if a person is having a heart attack or if they're having some chest pain, we want them to get the medication very quickly. You'll also notice that birth control does not come with the package resistant container either. It's normally like those little blister packs, right? So there are some drugs that are an exception to this. It's your responsibility to kind of remember them. One that I will tell you that's a very common drug that you will see pretty much probably on your exam is nitroglycerin. It does not have to have a resistant cap, and it is used for chest pain as well as chest angina, which is the same thing as chest pain, okay? OSHA, Occupational Safety and Health Act of 1970. This law was put in place in 1970, and it ensures a safe and helpful workplace, okay? So this is where, they put in place that the employees or the employers must make sure that they are providing a safe place for their employees to work, okay? Workers' comp and all of those things have been put in place to improve the safety of the workplace, okay? It also requires that the employer has a reporting system for job-related injuries and illnesses. So that means that if a person works at a plant and they're exposed to some type of chemical, they have to have, that particular job has to have a way for that patient or that employee to be able to report and say, I was exposed to chemical on such and such day, and these are the results of that exposure, right? And then another thing you want to remember about Occupational Safety and Health Act of 1970 is that they are the ones that require a safety data sheet to be at every job. Okay. And so that's something you want to remember there. Over 1990, okay, over 90. This particular law requires that a pharmacist must review for all prescriptions for contradictions, not contradictions, contraindications, drug interactions, incorrect drug dose, clinical abuse. Okay, they must review the patient's profile up against any new prescription that that patient is getting ready to take. Okay, the pharmacist must also offer patient counseling on any new prescription, and it's definitely a mandate for them to offer counseling to any individual who may be receiving Medicaid or Medicare or any government insurance. They are required to offer counseling to them. Okay. With that being said, this is why it is important for when a new patient comes into the pharmacy, or even if it's a patient that comes all the time, that we get the updated patient profile information, okay? Because we want to make sure that if the patient is taking a medication that they have not listed on their profile, that we know about it, because that's how we can prevent what? Medication errors, right? We can prevent medication errors from happening to the patient if we know what the patient is taking prior to the error happening. We want to make sure that we can be as proactive as we possibly can, opposed to being reactive, right? And so whenever you see a customer that comes in, even if it's a customer that comes in all the time, verify their information. And when you verify the information, you don't want to say, hey, is your address still 555 Jane Doe Lane, I Love You, Texas? And then, if they're not paying attention, they might say, yeah, that's the address, Lindsay. Or, instead of saying it like that, you want to ask them, can you please verify your address? It's an open-ended question, right? Can you please verify your address? That makes them do something, opposed to them just agreeing with you. You want to ask open-ended questions so you can really get the patient engaged, so they can give you, the correct answers. You don't want to ask a question where you're kind of being biased, I guess, and you're saying, you're not allergic to anything, are you? And they're going to say, no, I'm not. But if you ask, are you allergic to anything that we should know about? That makes them think, am I allergic? Now we can get a conversation going, because we want to make sure that we prevent any harm. And this also helps our pharmacists to do their job better, because now they can do proper counseling, okay? Please also note too that when the pharmacist is looking at the new drug and they're comparing it to the patient's profile already, they're looking to make sure that the new drug does not have any indications or contraindications against what they're already taking, okay? They want to make sure that this is not going to interact with this drug, okay? They're trying to prevent drug-to-drug interactions, okay? And so we need to make sure, or any food to drug interactions, they're just trying to prevent any type of error that could occur inside of the pharmacy. I hope that you guys are writing this information down, because tonight's lesson has really been a big nugget for you, and this is really going to help you as you are studying, okay? We've saved the best for last, which is the HIPAA, Health Insurance Portability and Accountability Act of 1996. 1996 is when HIPAA was put in place, okay? This particular law or act requires that patient confidentiality be maintained, okay? It also protects their protected health information, right? It says that they cannot release protected health information, social security numbers, addresses, patient conditions, right? If the patient has not listed you down as a person that can know the information, this requires that, they have not listed you down, then they cannot give you the information. You might say, well, that's my mama, that's my cousin, that's my sister. It might be, but if they don't have you listed, they're not going to give you anything. And they have to do that to respect this law, okay? Also, HIPAA can be broken in the pharmacy if you are having a conversation with your coworker about a lady who just came in, that may have had, you know, a condition going on, and you're like, you know, oh, did you see what she came in here to get? Oh my God, I didn't even know she was going through that. You know, that's because you're having conversation about this patient's condition. Or I give you one even better. If you work at the pharmacy and you know somebody who comes into the pharmacy that may be dating your friend or your cousin or your loved one, and you know, maybe that person is coming in with an illness, um, and you're like, oh, I gotta tell my cousin such and such just came in here and something is wrong. I got to tell. Now, if you tell, you breaking the HIPAA law. You are breaking the law, so you cannot communicate any type of confidential information. As much as you may love your loved one, that's not your place. Remember, we talked about ethics and laws in the beginning. Okay. And so, in order for you to maintain good standing in the pharmacy, you cannot have conversations with anyone about anybody's conditions without their consent and without, you know, them being present. And I'll just be honest with you. Don't talk about it. Let that be their um, you know, thing that they disclose with that person. You don't want to be the one to break the news and tell somebody something. You know, you just kind of have to say, well, you know, hopefully they're making the best decision, and just move on and just move on, and don't get caught up in that, because HIPAA can be very, you know, you could get pulled into some things very easily, and you know, you don't want to get caught up and pulled into that, because this is a law. So remember, HIPAA is patient confidentiality, not gossiping in the pharmacy and sharing other information about people to someone else. Okay. And so you want to make sure that you are maintaining proper HIPAA at all times, okay? Um, because if not, it could potentially cause you to get in trouble, okay? Everybody is good and that everybody understands everything. And so tonight, as we close out, as always, I want to encourage you that if you are still looking for help, and if you are needing some assistance with, you know, actually learning this work and understanding this work and feeling comfortable with this work, and you know, being confident enough to approach your board exam, please contact us. We would love to work with you. We have one-on-one tutorial sessions that I host myself. I do have some other people that I kind of work with as well, but for the most part, I host the sessions myself, and so you will have an opportunity to work directly with me, okay? And for that reason alone, I like to work with you and share information about, you know, what I've learned in my experience. With my sessions, you have access to practice exams. I also share different tips on how to pass the exam, build retention and memorization. We focus on your weak areas, okay, to make sure that you are taking in this information and that you are understanding it to the best of your abilities, okay? And so if at any time you need some assistance and you're like, I just can't do this by myself, Lindsay, please help me. I am more than welcome to, or more than available rather, to help you as much as I possibly can. If you are looking for a way to contact us, it is 903-295-5933. If you have not subscribed to our YouTube channel, please hit the subscribe button and ring that bell, okay? Also, if our videos are helping you, be sure to give our videos a thumbs up. We want to make sure, you know, that's one of the ways that we can connect with you guys and make sure that what we're doing is actually making an impact on your studying, okay? If this is really helping you, and if our YouTube channel has been a big instrumental part in your studying, give us a thumbs up. Like us, like our channel, okay? Subscribe to our channel. We want to continue to keep bringing you new and fresh content. Remember, every Wednesday at 1 o'clock Central Standard Time, we upload a new video. This past Wednesday, we did have some tech issues, and so we did do the video. We just haven't uploaded it yet because we've had some tech issues for a couple of days now. But we are going to still upload that video. So you'll see two videos, this one and the video from last week, uploading pretty soon, okay? This video will be uploaded Wednesday Central Standard Time, 1 o'clock p.m., okay? If you have any questions, any comments, concerns, drop them in the comments box below, okay, on our YouTube videos. Make sure that you drop them below. And as always, continue to do what you're doing. You guys are very smart. You guys are on the right track. You are doing something in your life that you've never done before, okay? And you may say, well, I've taken this test before and I haven't passed it, but you have never done it this way. You might have done it another way in the past, but you've never done it this way. So as you embark and embrace upon something new, and as you get closer to your goals and your destiny, make sure that you enjoy the journey. Okay, I was just sharing with someone the other day that if you're bringing a new thing into your life, bring it in your life in a very peaceful, happy way. This doesn't have to be stressful, guys. You don't have to, be studying for this test and feel stressed out and feel discouraged. Don't go at it by yourself. Work with someone. Work with me. I'm here. Book a session with me. Let's get this done. Let's knock this out the park before 2019 ends, okay? You're on the right track. You have what it takes. If you were not supposed to be here in this place, you wouldn't be here. If everything in your past hadn't prepared you for this moment, you wouldn't be where you are today, okay? So continue to believe in yourself. The first thing you have to do before you can consume this information is you have to trust and believe in I. You are the answer, and you can do this. There are so many people who are connected to you. Don't give up, okay? This is just a part of the journey. It's a part of your story. So one day you're going to help the next person to push through. Don't give up. You're too close, okay? If there's anything I can ever do, reach out to me. I'm here for you, okay? Until then, the next session that we're going to have is going to be the second Monday in November. I look forward to seeing you all. Stay happy, okay? And continue to study and continue to trust and believe in the process. You are closer than you think, okay? Have a great night, and we will see you next time. Have a good one. Bye.